Well, of course, the Conservative Party is looking for a new leader, and so far only a few have been brave enough to throw their name in. One of those contestants is with me now, Kellie Leitch, a doctor, a surgeon, a member of Parliament, and now leadership contender. Welcome.
Thanks for having me.
So what made you decide to throw your hat into the ring? You've been an MP since 2011. Before that, you were a doctor. We'll get into that whole business later. But
yes,
some people would say 4 years in, that's not enough time.
Well, I've been passionate about our party and passionate about the country for decades. I've been a member of the party since I was 14, and for me...
So 3 or 4 years now.
Yeah, look, I am, in my mid-20s for sure. But, I'm passionate about the party. And we were very blessed. We had an amazing government that was focused on being fiscally responsible, doing the things that had our economic house in order for a decade. Lowering taxes, making sure we dealt with the debt, creating jobs. Mm-hmm. And I believe that the party can be even more than that we can answer the question why for our membership and for the Canadian public. And for me, simply put, it's about hard work so we can go help others.
What do you mean the question why?
Well, as fiscal conservatives, as individuals that make sure that we can serve our resources, we do that so in the future we can make sure that, for example, my dad's business can grow larger so we can employ more people. Or as fiscal conservatives, we know we can serve our resources. So if someone has a disability, we actually can take care of them. We're compassionate. If you're a young person and you're looking to see what's that great opportunity for skills development, we can help develop those opportunities. And as I say, it's about working hard so we can help others. More broadly for us as conservatives, our conservative values, I think, are rooted in that. Working hard, making sure we're generous, freedom from government interfering in our lives, and making sure that we're tolerant.
Do you think that people get the correlation between what we're paying in terms of debt payments, the interest on the debt? I mean, province of Ontario, you and I are both from Ontario.
Yes.
We're sitting in Vancouver now, but we're from Ontario. It's $11 billion. It's about $1 billion a month almost that we're spending because it's north of $11 billion. At the federal level, it's still $30 billion.
Oh, these are
so
enormous
how many
numbers.
people could you help? If you really care, if the people on the left really care about helping the less fortunate, how many people could you help if you weren't spending $30 billion just on the interest payments?
Well, think about it. You're at home and you've bought a house, and then you get a second mortgage, and then you get a third mortgage.
This sounds good.
What can you actually then do to make sure you're taking care of your family, or do you have enough money to donate to a local charity? The answer to that is no. And that's what's happening right now with our Liberal government. They are mortgaging us to the hilt. And that means that we actually can't be generous as a nation to those people that need it the most. When we're fiscally conservative, when we conserve our own resources, we actually can take care of others. And I know this party is the party that's going to be able to do that in the future. Taking care of our armed forces, making sure that they have the tools they need to defend our democracy abroad and help others come to democracy, but also making sure people here at home are taken care of.
What would you say then to convince people that are enamored with the current government, enamored with, there's a honeymoon going on. There are people who, some voted for Conservatives in the last election, didn't in 2015, or they just suddenly got excited about politics. How do you get those people and get them to switch from red to blue?
Well, I think at core, all Canadians share a certain identity. They share the same values, and those values are conservative values. People go out and work hard in this country so they can take care of their families. People in this country, and people who have come to this country recently, or even my family that came in the 1800s, came here because they thought this was the land of equality of opportunity, that they could accomplish what they wanted. Mm-hmm. The Liberal government isn't creating those opportunities. In fact, as we were just talking about, is creating this enormous amount of debt that will just weigh people down. I believe that those conservative values are the ones that have to be represented in government. Hard work that's rewarded, generosity, freedom, and as I say, freedom from government interfering in your business, and freedom also that we fight for abroad.
Okay, let me throw this at you quickly then. You were on my radio program recently talking about your leadership ambitions and the contest that's going on right now. The other day I had somebody call in and say, we were speaking about Stephen Harper's legacy, and they said, well, you have to realize, Brian, Canada is a liberal country. What would you say to that person to get them to say, no, I'll consider voting Conservative and I'll consider voting for Kellie Leitch?
I would say that the Canadian identity is grounded in conservative values. And those conservative values are the values that we all as Canadians live every single day. We go out and work hard so we can take care of our families. We believe in freedom. Freedom both that we fight for abroad and freedom here at home, economic freedom from government bureaucracy and governments interfering in our small businesses, or actually, if you're a gun owner, thinking you should have a long gun registry. We are the party that represents Canadians' identity and why people come to this country. And that's why I believe overwhelmingly Canadians are going to be voting Conservative in 2019.
Kellie Leitch is, as I said off the top, many things.
Okay.
You used to be a doctor. Well, you
I
still are
am
a doctor. I know that, like other doctors, I remember speaking with Keith Martin when he was in Parliament. He used to go and do rounds now and again, or practice, because you guys have to keep up your skill set.
Right.
But that's not your primary occupation now.
Well,
when someone is a doctor, you spend a lot of time
being
going
educated.
through medical school,
Yes.
going through training. Why did you leave being a full-time doctor to become a politician? What was the draw for Kellie Leitch to say, I want to do something different?
Well, you know, in 2006, I was asked to chair the panel for the Children's Fitness Tax Credit. And it was the first time I could take my professional background as a doctor and apply it to good public policy development. Instead of just 150 children a week or so that I would see, over 8.5 million Canadian children benefited from that. Something that I think that Canadians appreciated to get their kids out and active. In 2011, I stepped up to run for two reasons. Two mentors that encouraged me to. Jim Flaherty on the one hand, who wanted me to run because he saw it as a great opportunity to have, I think, a young woman who is well educated involved in our government. But on the other, a guy named Dr. John Wedge. He's the chief of surgery at Sick Kids. And John was very clear with me. He said, you know, you have a responsibility to step up. We need the healthcare profession represented in government, and you'll have an opportunity, Kellie, to not just influence 150 families a week, but literally millions of Canadians. And he's right. Public policy development in this country is extremely important. And as I mentioned before, having that Canadian identity, conservative values represented in government, I think is important. They are what built this country, and they are those that will actually allow us to be a united country moving forward.
Well, as a conservative working in a socialist healthcare system, you must have been frustrated at times. I always tell my American friends who are worried about this, I say, look, when you get into Canada's healthcare system, you'll be well looked after. It is, you know, the care is fantastic. It's getting in that is going to be the problem. What were your frustrations as a conservative working in a nationalized healthcare system?
Well, look, I think that right now, and I still practice medicine, I do call at the Children's Hospital in Ottawa. I'm there as a volunteer. And what's frustrating for me is that I was part of a government that was fiscally responsible, and therefore, because of that, was able to increase transfer payments on the health side to provinces like the one I live in now, in Ontario, and across the country. But we didn't see the results of that fiscal responsibility in the operating room. We saw and we see lineups getting longer. We see people, like families in Ontario who have children with autism, not having access to care.
Even though the money's there.
You know, we were, and our government, I think, was very proud of the fact that we increased those transfer payments so that Canadians could get the services they need, Canadians could be taken care of. We were out working hard so that we could help others. The Liberal government in Ontario, and I think we'll see the same with the Liberal government federally, they do not understand that you actually have to generate wealth to be able to pay it forward. And in my operating room, and parents with autistic children across the province of Ontario are realizing it now. Those services are just simply not available because their government hasn't been fiscally responsible.
Operating room.
My operating room,
What did you do?
I'm a pediatric orthopedic surgeon.
Okay, so explain that.
So I take care of kids that jump off swing sets and break bones.
Okay.
You know, and so when I was in full-time practice, a portion of my practice were kids that were trauma, so fell off a swing set or broke their ankle playing hockey, And a big portion of my practice were children with significant disabilities, cerebral palsy, many of them full-time wheelchair users. Now I do trauma call, and so I meet kids.
So you're CHEO, the Children's Hospital of Eastern Ontario. When you're in Ottawa, you pop in there and
well, I do call on the regular call schedule like everyone else. So we see kids in the emerge, and I operate on them. It was very amusing. A few weeks ago, I saw a mom, and I saw their little girl, and I talked to the little girl. She was about 6. Went in, fixed the elbow, went back out to the waiting room. And I'm talking to Mom like I'm talking to you. I don't know if you have kids or if they've
4.
Ever had had any surgery. I'm talking to Mom, explaining what we did, and I'm talking to Mom. Mom's looking at me and looking above me and looking at me and looking above me and looking at me. So I looked above me, and it was me on the TV. Very awkward, very awkward. And there was this pause. It was like, and I was like, oh no, here it comes. Like, Mom's going to be mad. Oh no, like. And I sort of steeled myself. And then Mom looked up and she goes, I'm a labor lawyer. I should know who you are. I was like, phew, good grief. I survived. But, that Mom then talked to me about what she was really concerned about. And I think when a parent puts their most precious asset in your hands, when you then go and they realize that you're another type of public servant or you're an elected official, they talk to you about what's important to them. And for her, it was her son getting a job. And that was important for me. It makes me, those type of experiences and working at the hospital, I think, make me a better parliamentarian. They allow me to actually understand at a very grassroots level what Canadians are going through and not to get caught up in the bubble of Ottawa.
And there is a bubble, and I'm guessing that you're getting lots of feedback as you travel the country right now.
It's outstanding. I have to say it's a complete privilege being a member of Parliament, but it's also outstanding meeting so many Canadians across the country and getting their input during the leadership campaign. And it's quite humbling to have people step up and offer to volunteer and help on the campaign. And for me, what I'm hearing about is, as I said before, this Canadian identity. Certain values that Canadians all actually live every day. We go out and work hard so that we can take care of our families. And that's what I'm focused on over the course of the leadership.
Kellie Leitch, thanks so much.
Thanks so much for having me. It's great.
Thanks for watching. Click here to never miss a Rebel update. Want even more of the Rebel? Well, click here to become a premium member.